Hello, my name's Anoop Rehal. I'm a consultant obstetrician and fetal medicine subspecialist working at the Mums Clinic in Solihull. Today I want to talk to you about the findings of when your baby is predicted to be small or have a lower weight than expected on your ultrasound scan. Now, this would be picked up at any of your routine ultrasound scans, and that might be at the 20-week scan or later on in the third trimester from 28 weeks of pregnancy. And the sonographer will have done a series of measurements of your baby, and the overall weight of the baby will be lying outside the normal range, on the smaller end of the normal range. The possible reasons for why this might be happening are, firstly, the baby may just be a small baby. Perhaps the parents are smaller than average, or it may just be that the baby is slightly smaller, but what we might call normally small. And these babies most often catch up once they are born. And we also refer to this as constitutional smallness. The second reason why babies might be predicted to be small is as a result of what is known as placental insufficiency. So the placenta may not be supplying the baby with the oxygen and the nutrients that it needs in order to grow optimally. And there may be other clues in the ultrasound scan. For example, there might be less fluid around the baby than usual, or there may be abnormalities in the blood flow in the umbilical cord. Another reason why babies may be predicted to be small is due to certain infections that might have been picked up by mum in the pregnancy and passed across the placenta to affect the baby. And one of the signs that these might cause is a small baby. Often the ultrasound shows up other differences which are associated with these viral infections, and the common infections that we suspect are called CMV or cytomegalovirus, and also toxoplasmosis. Finally, another reason why babies might be smaller than average is because they are affected by an underlying chromosomal abnormality or genetic syndrome. And often the ultrasound scan may pick up other differences in the development of the baby. In terms of how these possible causes might be diagnosed, you may be offered blood tests to look for whether you have been exposed to some of the congenital viruses like CMV or toxoplasmosis or not. You may also be offered invasive testing to look for chromosomal abnormalities or genetic syndromes. And this test is called an amniocentesis. If placental insufficiency is the most likely reason for why the baby is small, then your doctor may do detailed assessment of the blood flows in your uterine arteries, so blood flows from you to the baby, which supply the uterus and placenta. And if those are showing increased resistance of blood flow, then placental insufficiency might be the most likely cause. And in this case, you would be offered a pattern of surveillance. So you would be offered more regular ultrasound scans, looking at the baby's growth pattern and looking at changes in the baby's blood flows. And ultimately, if the doctor is very worried about the placental function, then they would talk to you about the risks and benefits of having the baby earlier.